right, and I will now pass it over to Mark Luckner, who is the Executive Director over at the Maryland Community Health Resources Commission. Thank you very much for joining us, Mark.
Shamoya, thank you very much for this very gracious invitation. Really great to be with you this morning. Will you be advancing the slides?
Lorianne has got you.
Oh, great. Excellent. Well, I'm Mark Luckner from the Maryland Community Health Resource Commission. Been here since 2009. Before we go through the presentation, Lorianne, would you like to introduce yourself?
Sure, I'll say hello. Lorianne Moss. I work also at the Community Health Resources Commission.
Great. So let's go to the next slide. Okay, so this morning I'm going to cover a little bit about the Community Health Resource Commission, or CHRC, as you see there, and then we'll also talk a little bit about the Consortium on Coordinated Community Supports, which I know is probably of great interest to this audience, right, Shamoya? Okay,
Absolutely.
cool. Okay, I'm big on audience feedback, Shamoya, so that's okay, great. So the legislature, the Maryland General Assembly, created the Community Health Resource Commission in 2005 to achieve a couple of different policy objectives. Number one, to expand access to health services in underserved communities. Number two, to build the capacity of safety net providers that serve low-income Marylanders. And I might point out, in 2005, I actually worked in the legislature on the bill back then in a prior lifetime. This was several years before the Affordable Care Act. So it was groundbreaking legislation back in 2005. And to be able to help implement the act now in from the executive branch, it's very humbling, and I'm very grateful for that opportunity. Several years later, in 2015, many of you may be familiar with the Council on Advancement of School-Based Health Centers. We took that over in 2015. We've been staffing it since then. And Lorianne Moss is the lead person that works with us at the commission to staff that council from a day-to-day perspective. And I'm thinking, Shamoya, that a number of your members probably participate in the council. So thank you for that. And we'll talk about that work in a few moments, and I'll pass it over to Lorianne. Also, the Community Health Resource Commission is implementing another program, which is called the Maryland Health Equity Resource Act, or for some of you with the health jargon, it's called Health Equity Resource Communities. That's a program that was established in a separate bill in the 2021 session, and we're supporting 9 programs across the state, 3 in Baltimore City, 3 in Prince George's County, and 3 in rural areas to help address health disparities, improve health outcomes, and to help reduce avoidable hospital utilization. So that's another program that we helped launch within the last 12 or 18 months. And then finally, we're very humbled to be asked by the legislature to help staff the Maryland Consortium on Coordinated Community Supports, which we will talk about in greater detail today. And something tells me, Shamoya, we'll be working very closely with your organization here to help implement ongoing support of that initiative. Let's go to the next slide. Okay, so the Community Health Resource Commission, for background, is a state agency that works very closely with the Maryland Department of Health and other health entities. Many of you might know the Health Services Cost Review Commission, or the Maryland Healthcare Commission, or the Health Benefit Exchange. There's a whole group of us, but we're one of those what are called quasi-independent state agencies with a specific purpose that I described earlier, to expand access in underserved communities. And this is a group of our 11 commissioners. You might call them a board of directors, if you will. Great group of individuals who are appointed by the governor, and I'm just really grateful to have a diverse and highly talented group of individuals that I report to. 2 individuals I'll highlight for you are serving by virtue of the language of the act creating the consortium. They serve on the consortium. Ed Casemeyer, you may remember, he served for a long time in the Maryland General Assembly, including service as the chair of the Budget and Taxation Committee. He's our chair, and he serves on a consortium. And then second, another person here, her name is Sadia McKeith. She's a second commissioner appointed by Chairman Casemeyer to serve on the consortium along with him. Let's go to the next slide. So the impact of grants awarded by the Community Health Resource Commission. As I said, we were created in 2005. I've been here since 2009. And when you look back at the footprint of our organization, the commission has awarded over 665 grants totaling just under 120 million. and we've supported projects in all 24 jurisdictions of the state. And collectively, those programs have served more than 500,000 Marylanders, most of whom have complex health and social service needs. A special grant project that we had last year as part of the Relief Act that the legislature approved was a specific targeted RFP for individuals who receive services from DDA providers. We were happy to help launch that program. And we're particularly pleased that our grantees have utilized our public funding, because we're a state agency. You might consider us like a healthcare foundation, but a public agency, have leveraged more than $31 million in additional resources. And that's important because there's language in the act creating the consortium that looks at the long-term sustainability of the efforts of coordinating community supports, which is something that we for a long time prioritized at the commission. And we'll be working very closely with your members, Shamoya, to help push that out during implementation. Let's go to the next slide. So one type of grant that we've really prioritized based on our authorizing statute is school-based health centers. And we're thrilled that we've awarded 25 grants, just under $6 million in different areas of the state to do a couple of things. Number one, to open new school-based health centers. Number two, to help expand access to fluoride dental services in these programs. And then also other efforts to help expand services such as mental health and behavioral health services, and then also help promote the long-term sustainability via upgrades to their IT and other capacity building. Let's go to the next slide. Okay, I said earlier that our commission was asked to staff the council, that's the acronym here that you see at the top, the Council on Advancement of School-Based Health Centers. That's one of our statutory responsibilities. I'm going to pause here and see if Lorianne, you're the person most familiar with the day-to-day work of the council. Would you like to cover the work of the council?
Oh, sure. I can jump in for just a minute. Thanks, Mark. So as you can see in the slides, what the council does is it's charged with developing policy recommendations to improve the health and educational outcomes of students who receive services from the school-based health centers. We have 15 members that are appointed by the governor. We also have 6 ex officio members representing the agencies and whatnot. It's a very it's a good group. They work hard, and we prepare our recommendations for the legislature. We work very closely with MDH now as the health department takes over responsibility for the school-based health center program. So that's one of the roles that we have at CHRC.
Do you want to go to the next slide, Lorianne? You
Sure.
want to cover these? Yep.
Sure. So here's just some of the things we've been working on recently. We're working very closely with MDH to revise the school-based health center standards. They have not really had a comprehensive revision in almost 20 years now. So we've been working very closely with them on that. MDH, at the recommendation of the council, is doing a statewide needs assessment of school-based health centers. Both to look at where those additional grant dollars should go. This group may be aware of how the blueprint bill expanded funding for school-based health centers. So want to be very deliberate in how that grant funding is used, both new and existing school-based health centers. A third priority has been data, really trying to improve the quality of the kind of data that we're getting from school-based health centers on their impact and their operations. And then a fourth bullet is something we're working on quite a bit right now, which is supporting school-based health center financial sustainability, which is both through the grant program, Medicaid, and other resources that they need to be sustainable.
Okay, maybe I'll jump back here. So, so something tells me, Shamoya, that you and your members are probably more familiar with the creation of the consortium than us at the commission. But nonetheless, I will do this, and I'm happy to answer any questions. So as we know, House Bill 1300 that was passed during the 2020 session, I believe some of us call it the COVID session that ended early, the 71-day session. There was language, I think it was like pages 170 through 179, if I'm not mistaken, that created the consortium and it says that the consortium will be housed at the Community Health Resource Commission. So as we all know, the consortium is a new entity that is being formed, and there are many important policy objectives of the consortium, some of which you see here before you. And so to state them, it's to support student behavioral health needs, to promote student and family resiliency, promote educational attainment, develop best practices to support positive classroom environment, and to provide access to coordinated behavioral health services. A lot to do, a lot of work, and we're very excited, the Community Health Resource Commission, to work very closely with your organization, Shamoya, and others to help facilitate a successful launch and implementation of the consortium. And so to that end, if you want to go to the next slide, Lorianne. Just some background here. There was a second bill that the legislature approved last session, which was enacted in July, so a little bit over a month ago, that added additional members to the consortium, including a person from the state's Medicaid office that's been appointed. And then also it clarified that the fund established under the bill would be implemented by the Community Health Resource Commission. The first year of funding the consortium, which is at $50 million, is in fiscal 23, which began about a month ago. And as we said, there's 24 members, and we'll show you a list of the members on the next slide. And we're pleased that the legislature has named the chair of the consortium to be former delegate Dave Rudolph. We've met with him multiple times, and he's named August 17th as the date of our first meeting of the consortium, which will be online via Zoom. And Shamoya, we'll give you that link so you can circulate that to folks. You're welcome to join. All of our meetings will be open to the public, but that first meeting I'll highlight for everybody will be next week. It'll be an orientation meeting for the consortium, and if folks want to join Shamoya, I'd love to have folks join. And there'll be other meetings this fall, and we will be asking your organization to help get the word out and encouraging you to help contribute to a public comment process that we'll have later this fall. Let's go to the next slide. So you see a list of the members here, the appointees. I'm not going to name all the appointees that have been made. We'll list the folks up on our website as well. And Lorianne can put our website on the chat, and we'll give that to Shamoya after the call. But I would say, just in terms of observations, it's a great group of diverse folks. As we scan the list of folks, you can see it's geographically diverse. And as we recall, there's specific appointments or slots, some of us call them, for these appointments. And really looking forward to working with these individuals in the coming weeks and months. Let's go to the next slide. So Senate Bill 802 that Chairman Gazzoni introduced last year clarified that the consortium would have primary responsibility for achieving the policy objectives of the act. And you see them listed there. I don't need to restate them because we said them earlier. And then the commission, where we work, would serve as the fiscal agent for the fund established under the act, and would also provide advice as the commission prepares to issue calls for proposals or RFPs and administer the grant program. Let's go to the next slide. So here you have our contact information. Some of us at the Community Health Resource Commission, there are others in our office. And I would also say under the act that we were permitted to hire additional full-time staff, or for those of us that work at the state level, they're called PINs. And so we're finalizing the job description for the consortium director. And when that's finalized and the recruitment period begins, we'll send it over to you, Shamoya. And if we could ask to help circulate word about that opportunity, we want to recruit a diverse and highly qualified pool of candidates and have that person start and work with us. So with that, Shamoya, this is our last slide. I would thank you again for this invitation, and we look forward to working very closely with the organization in the future.